Hi, I'm Danny Chelius from the American Academy of Otolaryngology, Head and Neck Surgery, Annual Meeting Programming Committee. And I'm ecstatic to be here to visit with you this morning about our call for science for 2023 in Nashville. And I'm terribly grateful to have a couple of my good friends with me from our committee, Drs. VyVy N from UCSF and Dr. Michael Brenner from the University of Michigan. Thanks for being with me, all. Good morning.
Morning.
Good morning. Thanks for having us, Danny.
No, I'm really grateful. Y'all have been very, very involved, members of the committee, doing a lot of great work to put together what happened in LA and in Philly and in meetings before that even. And so I'm grateful for y'all to be with us to kind of share some insights to help people get ready for this year's Call for Science. Call for Science is open right now. It opened on December 1st after a lot of deep looks at the Philadelphia meeting and things that we needed to change, augment, continue. Let me ask, what were your favorite moments of Philly? VyVy, let me start with you.
Oh, I mean, the best part about the Academy for me is being back in person with people, right? Catching up with colleagues and learning opportunities about things that I haven't thought about for a while or that I want to expand my knowledge on. But ultimately for me, the in-person aspect of the meeting was really, really special again this year.
Michael, how about for you?
Yeah, I would have to second what VyVy said. I really embrace connecting with all the people. And while the virtual format has been really terrific, I have really enjoyed getting to see people one-on-one, the interactions. I love the great debates. And a lot of what happens that's so great about the meeting actually happens even outside the conference halls. So that opportunity to interact in those ways really was permitted by the way that we set up that meeting in Philly.
Well, I also had a wonderful time reconnecting with colleagues. I felt like there was something to kick me in the brain around every corner in the various different educational formats that were going on at the meeting. And we had the biggest turnout that we've had in at least a decade in the Call for Science last year. And so for a meeting that feels like it's getting to be a bit back towards the pre-pandemic feel, I think Nashville, I'm expecting to have a really tremendous turnout in the Call for Science this year. So this morning, I wanted to ask you if you all could give some advice to our viewers about being successful in the submission process. So let me start with you, Dr. Young. We have a lot of incredible panel discussions, a lot of excellent instruction courses. Can I ask you, could you describe for our viewers the main difference between panel presentations and instruction courses?
Mm-hmm. So the instruction courses or expert series, expert seminars, it's had a number of different names. I mean, the idea of those is that they are a discrete, it's usually didactic period, right? You're talking about a deep dive on a specific topic where the speaker or speakers, because there's usually only one or two, they educate and inform, right? It's essentially like a didactic session. And so what we're really looking for on the committee is for people to have some expertise and experience in speaking about this topic that they're teaching to the attendees. In contrast, a panel discussion is up to 4 people. And I personally really favor panels that are more of a discussion. I mean, it could be about a clinical topic. It could be about a controversial issue. It could be about a thought process or how you take care of different scenarios. But the panel presentations are really better targeted as sort of a discussion of a topic amongst, differences of opinion or conversations about, what does the evidence show or what are the treatment modalities to consider and why do we do these different things? And so they're slightly different formats in that way.
That was a really great description. And thank you for catching me. These presentations have had lots of different names over the years.
Yeah.
The instruction
it's so confusing.
It is confusing. It is confusing, even for those of us who spend many, many hours on this. The instruction courses came about in the early 20th century, back in the early 1900s, as a way to try to organize the sort of body of knowledge for the practicing otolaryngologist outside the academic centers of the East Coast. And we still see that today. The instruction courses sort of carry our body of established knowledge by our established experts, and then the panel presentations move the conversations forward. And so something I love about our Call for Science is that over 95% of the educational content at the meeting is submitted by members through the call for science. It's not invited by the committee. This allows the conversation going on in otolaryngology to rise to the level of the national meeting from our members, from our attendees. And so we're counting on our attendees to bring the conversation to the meeting. To that end, what would be your advice about crafting a successful submission for a panel presentation?
So I think that a successful panel presentation is a topic of interest specifically to attendees. Like, it's got to be something that's going to interest people and bring them in and excite them to learn about something, right? I think that having a diversity of opinions, a diversity of backgrounds, a diversity of every sense is very, very beneficial for a panel. I think that sometimes being creative and thinking outside the box can also be helpful, because we don't need, as much as I love it, we don't need 6 panels about vocal fold paralysis. We really don't. And so if you want to have a successful panel, I wouldn't probably throw something in that has, a bunch of, other people already doing the same sorts of things. So I encourage people to be creative, right? What are people experiencing day in, day out? What are the things that affect our patients? What are the things we need to learn more about? I'd put together something related to that.
That's great. That's great advice. And I think that you just hit on one of the biggest problems we see with submissions sometimes, is that it's a great topic by great presenters in an area that is already loaded with presentations. And so I encourage people to take a look at the past meeting programs available on the Academy website or on Otologic to see what's already being done at high volume, and maybe to think beyond those topics. How about
there's also identified gaps where the Academy has identified, based on feedback from attendees as well, about areas that we feel like we need to expand the educational offerings. And those could be an area of interest as well.
Absolutely. Definitely puts your proposal towards the top of the pack if it's addressing those gap analyses. And there's a link to those on the Call for Science website. How about for the expert series side of things? What are some tips for having a successful submission for that?
In all honesty, from the committee side, I think one of the biggest pitfalls that I've seen regularly come through with submissions is that people put forth an idea, they want to teach about a subject, but they provide no clear evidence that they have any background or experience or expertise in the topic, whether that's publications related to the topic or other presentations that you've given related to the topic. It's much harder for the committee to look at someone who says, hey, I want to teach about laryngeal trauma, but there's no clear evidence that they have any experience or expertise in this topic. And that's, unfortunately, the committee doesn't know everybody to know if you in fact can teach this. And so providing that can really help bolster your application in that zone.
I agree. I think looking at the bibliography portion of the submission and having a personal bibliography or presentation history relevant to the topic is absolutely critical for an expert series presentation. One thing that we're moving into this year for some of the previously presented expert lectures is the opportunity for some of our senior faculty to mentor some sort of new voices into their expert lecture. We're going to see some mentored expert lectures this year of previously successful expert lectures to help some of our rising stars in the field continue to build their presentation experience and presentation background to help them develop the expertise and the recognition as an expert. I would say if you are someone who wants to develop your expertise, it might be a good idea to look at a panel presentation where you can moderate a group of experts having a controversial debate about a topic that you're interested in. Because if you're the moderator, you don't necessarily have to have the expertise that all of your panelists do. What do you think about those kind of panels, Phoebe?
I think it's a great opportunity. I really do. And again, if you're putting a panel submission together, that's part of the diversity that I'm talking about, right? Diversity of experience, diversity of geographic region, diversity of clinical, context in which you work. I mean, all the different ways that we think about diversity. Being a moderator on a panel, I think, is a great way to introduce some experienced diversity, but also to allow young people to participate and to get involved and to build that experience. I think it's a great opportunity.
And one piece that I would add is to broaden the lens on what you're specifically proposing there, Danny, because this is a really important opportunity for our academy. It's bigger than mentorship. It's actually mentorship, coaching, and sponsorship. So in the process of bringing up these new voices and new ideas, we're basically creating a space where we can take someone earlier career, they can be coached. So they're not just put into that position, they're sort of helped through that process. They're mentored along in doing so. And the Sponsorship Act is actually identifying that talent and then basically creating that window or opening where they can shine. So we're really excited to see how this new approach is going to unfold.
I really love to see us using every platform and everything we do at the Academy as a route for mentorship, coaching, and sponsorship, whether it's presenting on these educational offerings at the meeting, participating in committees, participating in advocacy work. There's an opportunity for us to do the work, do the education, but mentor and coach at the same time. That is so important. And I'm excited about seeing how it plays out this year. Michael, let me come over to you. Let's talk about scientific abstract submission right now. In terms of the scientific orals and the scientific posters, what goes into generally getting ready for a great submission for the meeting?
Yeah, that's such a great question, Danny. And before I even tackle the specifics of what makes for a great scientific abstract, I want to highlight something that you had said about how much of our meeting comes from the people submitting proposals. So you are the meeting. We have done a really great job collectively in the Academy at democratizing knowledge. And so these submissions, the scientific sessions, the panels, the abstracts are really the very substance of what this meeting is, which is why I'm so excited that we've had an opportunity to speak to this. Now, getting down to the brass tacks of kind of what makes for a terrific scientific abstract or what makes it shine, it really comes down to how does it advance our profession? And the way that you make your abstract something that's value added can be broken down into showcasing your efforts in 3 areas: that the planning for the project was thoughtful, that you did good work with solid methods, and then that you showcase that work effectively in a way that was convincing and compelling.
When you say planning for the work, if I'm a young resident or a medical student and I want to get into presenting at the annual meeting and doing this, how do I even get started on the planning end of it?
Sure. So first of all, find a mentor. A successful abstract, or any project, it begins with a compelling research question. A high impact project, it's going to address a clinically important problem that's going to deepen our understanding and it's going to expand our knowledge. So for example, hypothesis-driven studies are great because they test our assumptions. They address challenges in our patient care, or they inform our clinical practice.
When you say hypothesis-driven studies, can you draw, what are you comparing that with? I think a lot of our young trainees might not be aware of the difference between a hypothesis-driven and non-hypothesis-driven research project.
Sure. So hypothesis means that you started with an assumption or a question that you're going to either prove or disprove. And this gets to the next component, which is kind of showing how you did the work and how strong your design was. So the goal here is to basically have some rigor around the science so that your work is convincing. A stronger research design means that you have less risk of bias. There's more internal or external validity, and there's going to be more impact. So for example, a study where you have a control group is going to be stronger than an observational study, and it's going to allow you to test that hypothesis. A prospective study is going to be stronger than one that's retrospective. Randomized studies are the gold standard, and how you do the statistics is also going to allow us to know if the findings that you have are significant.
When you were coming up as a student, as a resident, presenting at national meetings, I'm assuming, though, that you were not designing your own projects necessarily.
Yeah, absolutely not. So having a mentor and often even a mentoring team is really critical. And that's going to be part of making your points really clear, being able to sharpen that question of something that's testable and that's going to have some impact on the field. So the research question should always be easy to pick out, and the methods that you use and the sampling should be clearly highlighted as salient findings. It's so easy for us as reviewers to see those abstracts that were crafted at the 11th hour that didn't really have the benefit of that mentor input, or doubling back to, put that extra shine and refinement on it. Like we can see it a mile away. So one of the most important things that you can do is really be thoughtful, plan ahead, have the foresight. So the people that are watching this session, they're already halfway there because they're not at the 11th hour. They're thinking, okay, how do I up my game? What's the playbook? How do I make this a really compelling abstract that's going to be one of those shining jewels that's going to be invited for a poster presentation or best in class?
Okay, so they did their planning right. They got a mentor, they've executed or are executing a project. How do they make it shine? How do they make the abstract shine?
So I would argue that a lot of it comes down to clarity. So again, that research question needs to be really clear. If people don't know what you're talking about, then they're not going to be interested. You have to position it in a way so people can say, okay, that's going to be useful, relevant, meaningful for my practice. You have to make it very clear what your methods were, who you were sampling. So if we don't know who the patients were, who qualified or didn't, we don't know if it's valid. Sometimes you look at a study, you can't even tell if it was done prospectively or if people were digging back into, old work from their own institution. Obviously, if you can bring together data from multiple institutions, that's even more compelling. One of the areas that's really challenging is database research. So we've seen an explosion of work in the database space, and there's a whole spectrum. So some of our best and some of our weakest proposals have been in this particular space. And so mentorship with those is going to be really critical.
So you've got your project planned out. You've executed your project well and done it well. You're doing your writing. And you go to submit your science to the meeting, and you have to make this decision between submitting a poster or submitting an oral abstract. How do you decide between, and what would you advise people looking at that?
Oh, now that's a tough one. I think that a lot of people will often aspire to a presentation, and then if it doesn't clear the bar, it may land in the poster spot, but you can get a lot of play with a poster presentation as well. Part of it is if you have a story to tell, sometimes a presentation is a little bit more conducive to it because it has a series of slides. However, the time in which you have to discuss it is very narrow. So if you want to get into the real nitty gritty of some of that, granular data, sometimes the posters can actually be a really useful platform for developing that valuable skill.
One of my favorite moments in the meeting last year was at the poster reception. I met a student who had a presentation on gender affirming care and otolaryngology, and the poster was beautiful, and we got to have a great discussion about his work. And I learned more in that 10-minute discussion with him than I have from a lot of oral presentations. And so for him, with the beautiful story that he told on his poster with the graphics, and then the conversation we got to have, for me, that was one of my most valuable moments of the meeting last year. And so I think there is definitely strengths to going either way. And frankly, for medical students and residents, a lot of the times presenting in any format at the meeting is your ticket to the meeting. It's how you get funded to come to the meeting. It's how you get permission and time to come to the meeting. And so I would say any presentation is a good presentation when it comes to the meeting. Michael, any specific major landmines, torpedoes for a scientific abstract that we need to be on the lookout for?
Absolutely. So I want to highlight that we really, as reviewers, thoroughly enjoy seeing the wonderful science that's bubbling up. So I love to accent the positive. So any of these critiques, or pitfalls are kind of offered in that spirit so that people can share their work in the best light. And it kind of follows from a little bit what you were saying, Danny. So you highlighted that you can have great presentations, you can have great posters. But sometimes those submissions are also your toehold and your opportunity to get to the meeting. So the single biggest pitfall is people splitting their focus. So sometimes in the peer-reviewed literature, we talk about the phenomenon of salami slicing, where you basically could have one good study and instead you have 10 little pieces of studies. And since there's a lot of cross-communication among the different reviewers, this is one of those things too that gets spotted from a mile away, and it does not strengthen a submission. The analogy that I would make is if you think of applicants to the specialty, if they decide that they're going to apply in general surgery and urology and ENT, it looks like they don't really know what they're doing, instead of having one targeted, effort, in the specialty of their choice. By the same principle, if you can put together one really solid proposal that basically looks at multiple different covariates and has some depth in how it looks at a problem, that's going to be far more compelling than splintering it into a bunch of little projects that look at some different parameter, but are essentially asking different aspects of the same focused research question. So that's probably the biggest thing that I would say. The second biggest thing is that aspect of preparation that we alluded to. So if you engage your mentor early on and you give them opportunities to iteratively look at your proposal, then it's really going to show, because a practice hand is always going to just kind of know what's going to fly, what's going to sink and what's going to swim. I guess if I were to say a third piece on what's useful, it's getting even opinions beyond your mentors, so that broader stakeholder engagement. And that really ties in with what VyVy was saying. So sometimes that diversity means that if you did a literature search, that you brought in a informationist, which is what the technical term now for librarians. Sometimes if it's a topic that may have implications for equity, it means diversifying the audience that listens to it. Sometimes it's having that statistician weigh in terms of the plan, so that you ensure that you have a really robust presentation.
I 100% agree. And I think that something really important you said was you got to have a great question to start with. I would say one of the pitfalls for me is getting an abstract that asks a great question and promises me the data, but doesn't have the data. I think you have to have the data when you submit your abstract. Promises that the data is coming, for me, is an automatic rejection from the meeting. You've got to actually show me some data in the abstract. Am I a curmudgeon on this, or what do you think?
Oh, I think that's very curmudgeonly, Danny. I personally enjoy reading abstracts that have no evidence or data. I actually serve as chair of the Outcomes Research and Evidence-Based Medicine Committee, and I think that it should really be very storybook oriented. As Albert Einstein said, creativity is even more important than knowledge. And I would recommend submitting abstracts that have no information whatsoever and are just sort of children's storybooks. Thanks for that.
It's been a pleasure having you on the committee, Dr. Brenner. I'll accept your resignation tomorrow. Thank you.
Yes, yes, please include the data. Hopeful promises of what's coming are not it. One other point that stems from that is that within research, there are studies where you choose to measure something and you know that you'll get a deliverable. And then there are studies that are much higher risk where we basically look for something. And those are some of our highest impact work. But if you haven't found anything, if you cast a net and nothing comes up, then that probably shouldn't be a submission. Now, having said that, a study that has negative results can still be very informative and very valuable. But if you don't have the data, I would say defer it to next year. We'll be really excited to see what you have to say, but it's not ready for prime time if you don't have the data.
Last thing I would comment on is, do you have any advice for how to make sure the conclusions stem from the project and are appropriate?
Oh, that's such a wonderful question, Danny. Thank you for highlighting that. So this doesn't just happen in scientific abstracts. This happens in papers that I review all the time, wearing my hat as associate editor for a few different journals. So if you make a claim in your conclusions that is not substantiated by your evidence, you're going to be called out on it every time. It's very tempting to overreach with our conclusions as well. Try to use a bit of judicious restraint. The conclusions are a place where you can highlight the opportunity for future aspirational work that will allow us to take that next step. But yes, your inclusions should reliably draw upon the work that you've done and the data that you're able to present.
Overblown conclusions really hurt an abstract.
Oh, yeah.
I mean, it's sort of like when I look at my kid after a swim meet and say, hey, you did a really excellent job on your freestyle. You dropped your PR 2 seconds. That was incredible. That is more meaningful than when I say, wow, kid, best swim meet ever, because they don't have the data to actually support that conclusion. It doesn't land as well for them as when I'm specific with what I'm complimenting and it draws directly from the data that I saw. And it's the same thing with the abstracts. If you overblow your conclusions, if they don't flow from the data, it really sticks out poorly. So
now there is a flip side to this too, Dan, that I think is really interesting. And this ties in with some of these notions of imposter syndrome and some differences that we see culturally across how individuals from different backgrounds, present their own expertise. So VyVy was talking a little bit about how important it is that we have a diverse set of our academy members presenting at expert sessions. I would also say that we want diversity in who's putting forth their scientific work. And some people might feel like, oh, maybe my work isn't good enough. So there's a certain amount of confidence and boldness in setting forth and standing on the good work that you've done as well. So it's a little bit of a continuum. There are those that will overblow the results, but there are also those that will make the error of understating, really valuable work so that individuals might not realize what it really has the potential to bring to our field. And that's where mentorship can be super helpful again.
I was going to say that I think is the main message that we as the program committee would like to encourage among our memberships is this year, please help your colleagues recognize their own expertise. Please help your colleagues find their voice. Please encourage them to submit to the meeting, to submit to the opportunity to come up and present and shine, because sometimes it is hard to recognize your own expertise, and we need each other to encourage that and to help us to help each other find our voices. And so, especially for those of you who are seasoned submitters, seasoned presenters, look around you, look at your junior faculty, look at your trainees, help them find their voice, help them recognize their expertise. That's going to make this a more meaningful meeting for all of us. Let me ask you, I'm going to come back and just say closing thoughts in a second, but thank you everyone for tuning in and hanging out with us to chat about the Call for Science. It is open until the end of January. January 23rd is the date for the close of the Call for Science for our annual meeting next September 30th through October 4th in Nashville, Tennessee. Dr. Young, closing thoughts.
I love what you said last about encouraging each other to showcase your ideas, showcase your experience, your expertise on the committee. We're always interested in seeing fresh ideas, fresh voices. It's a balance of finding the best educational offerings for attendees, but I love to see a great depth and variety of possibilities for us to consider.
Thank you so much, Dr. Brenner.
So the biggest thing that I would say is a big thank you, because as we highlighted, you all are what makes this meeting phenomenal. The other thing that I would say, although I'm probably tendering my resignation based on my stance on inclusion of data in our presentations, is that we on this session, Danny, VyVy, myself, staff, we are ambassadors. The whole annual meeting planning committee are ambassadors that want to be accessible to you. One of our biggest jobs is to help make the meeting more meaningful. So we want to hear your input. If you have a question or concern, we want you to consider us as accessible. You've kind of heard the collegial tone to this meeting. And I think that all of us are very approachable people. Your voices need to be heard, and please consider us accessible people that you can tap if you need advice, help, or have questions.
Well, thank you both so much. 127-year conversation, 127 years. Come join it in Nashville next fall, where we will define who we are and where we are going as a field and as a community. Thank you all for tuning in.